Good morning, everyone. I'm Dana Corson, a media officer with the National Academies of Sciences, Engineering, and Medicine. Thank you for joining us this morning for a webinar on the report that was just released titled Redesigning the Process for Establishing the Dietary Guidelines for Americans. You can now download a copy of the report and other supporting materials at www.nationalacademies.org/DGA review. And you can follow the conversation about the report on Twitter at #DGA review. For those of you not familiar with the U.S. National Academies of Sciences, Engineering, and Medicine, we are private nonprofit institutions that provide independent, objective analysis and advice to the U.S. to solve complex problems and inform public policy decisions related to science, technology, and medicine. The National Academies operate under a congressional charter to the National Academy of Sciences that was signed by President Lincoln in 1863. For each requested study, panel members are chosen for their expertise and serve pro bono to carry out the study statement of tasks. The reports that result from the study represent the consensus view of the committee and must undergo external peer review before they are released, as did this report. I have with me a few members of the committee to discuss the report's findings and recommendations. But before I introduce them, I want to go over a few technical reminders. After the opening remarks, we will begin to take questions through the Q&A box located in the right-hand corner of your screen. Simply type your question in the box at any time and click Submit. We ask that you leave the box set to send your questions to all panelists. If you have any technical issues during the event, please contact WebEx Technical Support. I'm going to give you the phone number. That's 1-866-229-3239. And now I'd like to introduce members of the committee who are here with us today. We have Dr. Robert Russell, Professor Emeritus in the Schools of Nutrition and Medicine at Tufts University. We have Dr. Barbara Schneemann, Professor Emerita in the Department of Nutrition and Food Science and Technology at University of California, Davis. And we have Dr. Bruce Lee, Executive Director of the Global Obesity Prevention Center and Associate Professor of International Health at Johns Hopkins Bloomberg School of Public Health. We'll start off with a presentation summarizing the report by Dr. Russell and Dr. Schneemann, and then we'll open it up for any questions you may have. Please note that this briefing is scheduled to last 1 hour. And with that, I will turn it over to Dr. Russell.
Thank you, and thank you for being with us this morning. The National Academies was asked by Congress to review the process to establish the dietary guidelines for Americans and to present its findings and recommendations in 2 reports. During this presentation, my colleague Barbara Schneemann will first review what the dietary guidelines for Americans are and review the recommendations made in our first report, which focused on managing biases and conflict of interest for the Dietary Guidelines Advisory Committee selection process, and that report was released last February. She will touch on our committee's process for this second report that we're releasing today, which focuses on improving the rest of the DGA process. I will then review our committee's recommendations for improving and redesigning the process for establishing the DGAs. So now I'm going to turn the first portion of this presentation over to Dr. Schneemann. Barbara?
Great. Thank you, Rob. So first I'm going to give a little bit of background on the dietary guidelines, just so you understand the context that the committee had for its decision-making. Dietary guidance has evolved over time from being focused on reducing intake or excessive intakes of food nutrients and calories to now include the goal of reducing risk of chronic disease. And complementing the evolution of the dietary guidance process have been updates in nutrition science and innovation in methods that have improved the process for developing dietary guidance. And some of those innovations include the use of systematic reviews to look at evidence, food pattern modeling, to be more food-oriented, and in general, there's been less reliance on the collective knowledge or opinion of experts in formulating guidance and more reliance on scientific evidence. So the dietary guidelines themselves, which I'll often refer to as the DGA, they provide nutritional and dietary information for the purpose of promoting health and preventing disease. the Department of Agriculture and the Department of Health and Human Services have been mandated by Congress to jointly update and present the DGA every 5 years. And then the DGA serves as a basis for federal nutrition policies, nutrition assistance programs, and nutrition education and advice for the public. According to the law that mandates the update and release, the National Nutrition Monitoring and Related Research Act, the DGA must be based on the preponderance of the scientific and medical knowledge that is current at the time the report is prepared. And so if we look at the most current process, we see that there are 4 types of analyses that are used to accomplish that goal. Original systematic reviews, existing systematic reviews, meta-analyses or reports from the literature, food pattern modeling, and descriptive data analysis such as one finds in Haynes. To accomplish this task, USDA and HHS have convened a Dietary Guidelines Advisory Committee under the Federal Advisory Committee Act, or FACA, to evaluate the scientific evidence. And because it operates under FACA, that committee has a 2-year time limit. Once their task is completed, the Dietary Guideline Advisory Committee, or DGAC, their conclusions are submitted to the secretaries of USDA and HHS as their scientific report. And then there's a federal writing team, which consists of about 12 to 14 USDA and HHS employees with expertise in nutrition science, policy, and communication that prepare the DGA document, the policy document itself. So now we're going to look briefly at Report 1, which was released in February. And the task to the committee for Report 1 was to look at the selection process and how it can be improved to provide more transparency, eliminate bias, and include committee members with a range of viewpoints. So one of the primary recommendations we made in that report was that the secretaries of USDA and HHS should employ an external third party to review and narrow the candidate pool to list a list of primary and alternate nominees, and USDA and HHS should in fact develop the criteria for creating that nominee. The committee believes that divorcing the screening process from the appointment authority that the secretaries have will reduce bias and improve public perception of the selection process. We think there are a variety of third parties that could do this, either another government or non-government entity with expertise in evaluating individuals' expertise and experience. And then the secretaries are selecting the final nominees from a short list of equally well qualified, non-conflicted candidates. The second that's the recommendation. The second recommendation is that once USDA and HHS develops its nominees, this should be proposed as a provisional appointees, and that list of provisional appointees would be open for public comment. Requesting comments on a list of provisional members encourages transparency in the process and allows the public to review and comment on how the proposed committee as a whole is balanced. There are several recommendations that we made regarding how to deal with bias and conflict of interest. Our committee concluded that conflict of interest, whether actual or perceived, cannot always be eliminated entirely on a balanced panel of experts. But we suggest 4 steps that can be used to help address any concerns. And briefly, those are: first, to have a process for disclosure of both financial and non-financial interests. Secondly, to develop a management plan for any disclosed bias or conflict of interest to minimize their effect on the overall process. Third, to have a federal ethics officer who's not involved directly in the DGA process but can independently evaluate the committee's bias and conflict of interest. And then fourth, documentation in the final report after the final report is released on how any conflicts or biases were managed during the process. The committee in Report 1 also made a recommendation that we think applies directly to Report 2 as well, that the departments should adopt a system for continuous process improvement to enhance outcome and performance of the entire process. So now moving to Report 2, this slide gives you the tasks that are a part of Report 2, the other 3 tasks. First of all, to look at how the nutrition evidence library is compiled and utilized, and whether NEL reviews and other systematic reviews and data analysis are conducted according to rigorous and objective scientific standards. The next is to look at how systematic reviews are conducted on long-standing DGA recommendations, and specifically how it includes viewpoints from a range of viewpoints from different scientists. And then the fourth part of the task is how the dietary guidelines for Americans can better prevent chronic disease, ensure nutritional sufficiency for all Americans, and accommodate a range of individual factors, including age, gender, and metabolic health. So first, I want to just briefly walk through the committee's key findings and conclusions before Dr. Russell starts going through the recommendations. So first of all, in looking at the process, we felt the process for updating the DGA should be redesigned to allow for the appropriate expertise and time to focus on each step of the process, which can be achieved by reallocating the steps to diverse targeted groups of expertise. So we bring the right expertise into each step. Secondly, that greater transparency is needed to produce trustworthy dietary guidelines and provide the assurances that decisions are not tainted by bias or undue influence. And when we looked at the current methods, we felt that while the current methods used in the DGA process are appropriate for the questions being asked, methods must be continually strengthened and advanced. So in terms of the types of evidence we reviewed a number of other guideline-forming bodies, but found that none were really comparable in function and scope to the DGA. And as a result of that, we conducted our own process redesign through the lens of process re-engineering, not to start from scratch, but to think about how to re-engineer the overall process. We also reviewed the literature that was available and consulted with leaders in the field about the state-of-the-art methods for conducting various types of evidence reviews and how to implement such methods. In addition, we had available to us the USDA listening sessions, so we had a wide variety of information available. So one of the lessons we learned from the other processes that we reviewed was that a clear sense of purpose and audience is needed. When reviewing the DGA process, we found over 10 differing statements of purpose for the 2015-2020 dietary guidelines. not widely different, but slightly different emphasis. So the committee believes that the audience of the DGA needs to include the general public and proposes the following purpose statement that can be used overall for the dietary guidelines. And that statement would be that the purpose of the DGA is to provide science-based, nutritional and dietary information and guidelines for the general public that form the basis for any federal food, nutrition, and health program. And that's based on what we found in the National Nutrition Monitoring and Related Research Act. Again, we're focusing on the audience being the general public, not just the healthy public. And so we see then that the goals of the guidelines are promoting dietary intake that help improve health and reduce the risk of chronic disease, and providing the federal government with a consistent approach for nutrition policy and messaging. So this next slide shows you the current process as it's structured, and we've identified 4 key steps in the current process. The first deals with administrative work, appointing the committee. The second step encompasses the work of the Dietary Guidelines Advisory Committee to review science. The third step is a step where the departments, USDA and HHS, solicit and review comments on the advisory report. And then the fourth step are the 2 departments updating and releasing the dietary guidelines for Americans. So in looking at this, we found 2 key points where specific comments are solicited. In step 1, at the nomination of committee members, and in step 3, where comments are solicited on the science report developed by the advisory committee. While the committee is meeting, public comments came in, but those 2 steps are where there is a key solicitation for input. So in Report 1, the committee developed a set of values to enhance the integrity of the process. And we believe that these values apply to Report 2 as well as Report 1. And so I'm just going to go through these values quickly. First of all, to enhance transparency, and I think as you hear the recommendations, you'll see that this is something we've woven in across the recommendations. The second is the importance of promoting diversity of expertise and experience. The structure we are proposing is intended to improve that diversity of expertise and experience used throughout the process that is relevant to the main tasks that are a part of the dietary guidelines process, which we saw as strategic planning and topic identification, review of relevant scientific evidence, and integration and evaluation of the scientific evidence to draw conclusions that can be sent to the secretaries that are based on scientific advice. The third area is supporting a deliberative process, and we've highlighted 3 elements here. Under the context of being adaptive and flexible, we believe that to be responsive to the complex and changing environment related to diet and health, the DGA should shift their paradigm from operating as a deterministic structure to one that has the agility to adapt to change and address high priority topics in detail. Our committee believes that the secretaries of USDA and HHS can adopt a more flexible process for reviewing, updating, and publishing the DGA that is consistent with the act that governs the process. So to be more flexible, the secretaries can recognize that not all topics require a detailed review every 5 years. Brief updates of evidence may be conducted, or a particular DGA recommendation could be extended and continued without an in-depth review. We found in the literature precedent to set guidelines that have an expiration date or a sunset clause. And so for DGA recommendations for which the strength of evidence is very strong, the expiration date could be longer than those for which the evidence is rated moderate. High priority topics for review during a DGA cycle could include One, those that had been reviewed previously and a body of new evidence now exists. Two, have met their expiration date. Or three, are new and being considered for inclusion in the DGA for the first time. An example of that is the B through 24 interest that will come into future DGAs. We think the advantages of being adaptive and flexible is that it can be more resource efficient than the current process, and in some ways be easier to implement by virtue of limiting recommendation to changes from the previous edition. Second aspect of a deliberative process is continuity, that the DGA cycles need to be considered as a continuous activity to foster learning across cycles. In this way, the body of evidence can grow and become more useful. And so instead of providing static recommendations that are relevant only for a given 5-year cycle or leaving the impression with the general public that recommendations change frequently. And then the third aspect is the continuous learning aspect, which you also will see in one of our recommendations, that the DGA needs to evolve and improve dynamically in order to achieve its goals. So other values that you will hear woven in across the recommendations are managing bias and conflict of interest and adopting state-of-the-art processes and methods. So this next slide, for those of you who might have downloaded already, it's on page 3.3 of 3-3 of the report, and might be easier to see in the slide. This table gives is designed to illustrate the overall model of the process we are proposing for the redesign to align with the values the committee believes enhance the integrity of the process. So that redesign includes separating certain functions in the process, allowing for more public input, and making the process more strategic across the DGA cycles. And we recognize that in implementing this, there will be some issues in the startup versus once the process is able to be an ongoing process. But before going into the detail of this redesign model, Dr. Russell will present the recommendation that relates to the structure.
Thank you, Barbara. I'm going to, first of all, talk about recommendation 1, and then I'm going to go back to the figure because it will be more easily understood if you have the recommendation before you study the figure. Recommendation 1 is that the Secretaries of the U.S. Department of Agriculture and Health and Human Services should redesign the DGA process to prioritize topics to be reviewed in each DGA cycle and redistribute the current functions of the Dietary Guidelines Advisory Committee into 3 separate groups. The first group is called the Dietary Guidelines Planning and Continuity Group. This group would monitor and curate evidence generation on an ongoing basis. It would identify and prioritize topics for inclusion in the DGA, and it would be able to provide strategic planning support across one DGA cycle to the next. The second group is technical expert panels that would provide content and methodological consultation to the Nutrition Evidence Library and federal staff during evaluation of the evidence. These panels could be virtual panels, don't necessarily need to be meeting face-to-face. The third group is the Dietary Guidelines Advisory Committee, but which we have inserted the word Scientific Advisory Committee to make it clear what the function of that committee is, to interpret the scientific evidence and draw conclusions. The evidence coming from the the Nutrition Evidence Library and the technical expert panels. Now I'm going to go back to the figure, and if you focus in on the upper left to begin with, I want to say a few words about what the shadings mean and the dark bars you see in that figure. Dark bars indicate solicited opportunities for public comment or explanations of why or how and what key decisions were made. The darker shaded boxes indicate active periods, while lighter of that committee or group that's working, while lighter shaded boxes denote potential times of possibly less active engagement as needed. For example, the ongoing surveillance would be a less active function versus when the prioritization and picking of topics is done by the planning and continuity group. The word selection in the figure refers to the selection of members for the respective groups. And federal staff includes those providing technical support, such as the Nutrition Evidence Library, as I've already said, and those conducting food pattern modeling and other descriptive data analysis. So if you focus now on the upper left at the acronym of DGPCG, which once again is the Dietary Guidelines Planning and Continuity Group, we envision this group as having ongoing activities through the whole 5-year cycle. When you first begin, when this schema is first introduced and started, during the first year, the DCPCG of the year 1 will be very busy, because not only will the members have to be selected, but that topic selection will also have to take place. After year 1, there's ongoing surveillance of the literature, and you follow it across to year 4. That's when a selection takes place of new members of the DGPCG, which would not be all members at once, would rotate off, but a certain number would rotate off. This group would be made up of combined federal and non-federal appointees. During the selection of members for this, of course, there would be bias and conflict of interest assessments going on. This group would work with subcommittees as needed to enhance their expertise. This next group that I'd like you to focus on down is the federal staff and TEPs as needed. This would work, this, as I said, would be the Nutritional Evidence Library staff, federal staff, as well as other staff that's conducting food pattern modeling and descriptive data analysis. This activity would go on for year 1 and year 2 of the cycle. The selection of members of the federal staff that would be working would be done during year 5 of the cycle. The DGSAC, the Scientific Advisory Committee, otherwise formerly known as the DGAC, the selection would take place in year 2 of the cycle. Now the DGAC can work for 2 years as before, year 3 and year 4 of the cycle, but it would work on a more streamlined list of topics that had been picked by them, by the continuity group, and prioritized by the continuity group. The Dietary Guidelines Scientific Advisory Committee would evaluate the quality of the data and write its scientific report. It would do a synthesis of the data that has been handed to them by the federal staff, the library staff, and the continuity group, and then be able to write their scientific report evaluating the strength of the data with conclusions. That report would then be handed over to USDA and HHS secretaries and the writing groups for updating the new DGA. Now, once the cycle is established, if you go back to the first line again, focus in on those points, all the points the bars where there's opportunity for public and stakeholder input or explanations to the public and stakeholders of why certain decisions were made and how they were made, on what basis. This is an effort to increase transparency tremendously. So we now, instead of having two solicited times or periods for public comment or explanation, we've now expanded that to 6 in an effort, once again, to increase transparency and trustworthiness of and participation, and therefore trustworthiness of the whole process. It's a complicated figure. I'm sure I have left out 1 or 2 key points, but maybe we could take those up, whatever I've done in the question period. I want to move on now to a conclusion of our committee, further conclusion of our committee, which then leads to other our other recommendations. Transparency and participation mentioned are needed to help build trust in the overall process, as I've already said. And that includes transparency and participation in topic identification, selection, and prioritization, as you can see in the figure, data collection and evaluation, data synthesis and interpretation and integration, which the DGSAC's function is, and the development of the DGA policy report by the Federal Writing Team. This leads to the second recommendation then, which is that the Secretaries of USDA and HHS should provide the public with a clear explanation when the DGA omits or accepts only part of the conclusions from the scientific report. Our committee further concluded that there needed to be a strengthening in the ways that systematic reviews are accomplished by the Nutritional Evidence Library. Original systematic reviews for the original reviews, new reviews that are being done as requested or as prioritized by the continuity group. Those who synthesize and interpret the evidence and formulate conclusions, and that's the Scientific Advisory Committee's job, is not to be leading the development of the systematic review protocol and the selection of studies. Those functions should be separated. For existing systematic reviews in the literature, meta-analysis, and other reports, these are generally appropriate and encouraged to be used, but existing studies need to be relevant, timely, and of high quality. The Nutrition Evidence Library needs to adopt a single systematic review protocol that is transparent and follows state-of-the-art methods. This recommendation then, and third recommendation that our committee had, is that the Secretary of USDA should clearly separate the roles of the Nutrition Evidence Library staff and the Dietary Guidelines Scientific Advisory Committee, such that the NEL staff plan and conduct systematic reviews with input from technical expert panels, perform risk of bias assessment of individual studies, and assist the DGSAC, the Scientific Advisory Committee, as needed. The NEL systematic reviews, new ones, should be externally peer-reviewed prior to being made available for use by the DGSAC. Some of this peer review might be done in journals peer review. Some of it would be done by other outside peer reviewers. The DGSAC's job, as I mentioned, would be to synthesize and interpret the results of systematic reviews and draw conclusions about the entire body of evidence. Our fourth recommendation is that the Secretary of USDA should ensure all Nutritional Evidence Library systematic reviews align with best practices by enabling ongoing training of NEL staff, enabling engagement with and learning from external groups on the forefront of systematic review methodology, inviting external systematic review experts to periodically evaluate the NEL's methods, and investing in new technological infrastructure, such as software which can track literature and extract data from literature and do text mining. Further concluded that there needs to be a strengthening of the abilities to do food pattern modeling. Food pattern modeling has been used, of course, in the past cycles, but it's useful for elucidating relationships among food group nutrient profiles, nutrient goals, and energy constraints, but currently is only able to answer a limited range of questions because average energy and nutrition requirements are used in that modeling, and the traditional American diet with the traditional American food groups is used, which doesn't account or take into account the heterogeneity of the U.S. population. Descriptive data analysis also, of course, is very appropriate, but limited by the availability of current data. That is, much of the data that's looked at with regard to health status, the American population, diseases, so forth, incidence, prevalences, and diets or nutrient intakes are more than 3 years old. All analysis need to be conducted, therefore, earlier in the DGA process to be of more use to the DGSAC. Fifth recommendation is that the Secretaries of USDA and HHS should enhance food pattern modeling to better reflect the complex interactions involved, variability in intakes, and the range of possible healthful diets by groups of Americans or subgroups of Americans. With regard to interactions, if there is a group that is a subgroup that is not eating, for example, dairy, for any reason, they tend to have differences also in other food groups with regard to intakes. That's one of the definitions that we use for a complex or examples we use to illustrate a complex interaction that's involved. Recommendation 6 is Secretaries of USDA and HHS should standardize the methods and criteria for establishing nutrients of concern. A nutrient of concern is that which is under or overconsumed by the U.S. population or a select population, subpopulation group. Problem has been that there's lack of ability to do comparisons between DGA cycles because the criteria have changed or are different from cycle to cycle based on the literature that is available at that time. So we make a recommendation to standardize the methods and criteria so that comparisons can be made from cycle to cycle. Another advance that we're going to be recommending has to do with systems mapping and modeling. The DGA can play a key role in advancing the understanding of the role of diet within the larger body of evidence and factors that affect health. And systems map can lead to new insights and advanced knowledge of the pathways concerning diet and health and making clear what the role of diet is in health. Thus, our last recommendation is Secretaries of USDA and HHS should commission research and evaluate strategies to develop and begin to implement systems approaches into the DGA. We realize this is new, has not been done before in the nutrition field, but we feel that this is what is needed for the future. And we need to begin something along these lines, we feel, during as soon as we can. The select strategies should then begin to be used to integrate systems mapping and modeling into the DGA process. During the question period, colleague Bruce from Johns Hopkins will be able to talk more specifically about that since this is a new area. So with that, I will end my presentation And I guess we can go to the questions.
Yep.
One more, I'm sorry. I need to say one or two things more, sorry. I wanted to thank our committee and acknowledge every member on that committee that is listed here. And for more information, the full report can be found at this site. Thank you.
Thank you, Dr. Russell. This is Dana Corson again. We'll now start with our Q&A session. Please type your questions into the Q&A box on the lower right-hand corner of your screen. Just to get us started this morning, can you tell me, how do your recommendations affect our current dietary guidelines, or what are the implications for the current set?
Barbara, do you want to start?
Well, I think it's important to keep in mind that the tasks for our committee were focused on the process for developing the dietary guidelines. So we were certainly interested in understanding how various committees have done their work, but we were not tasked to look at the specific guidelines themselves, really on the overall process and to make recommendations on the process itself.
Today our focus, this is Rob, our focus is really about trying to strengthen the system. We're not talking about throwing out the old system, we're talking about how we can make it stronger.
Thank you. Also, you mentioned that using a system science approach is a way to advance methods. Can you expand on what you mean by a system science approach?
Bruce, could you take that?
All right, thank you, Rob. Yeah, this is Bruce Lee from Johns Hopkins. So it's recognizing that the pathway between nutrients, so what you eat, and ultimately health and then health outcomes is not a direct one-to-one pathway, that it's actually quite a complex pathway. So the complexities involve you're eating multiple different types of nutrients, they're part of different types of food, the body may metabolize these nutrients in different ways, and then the translation from the nutritional intake to different types of health conditions and chronic diseases can be affected by many other different types of factors, such as environmental factors, behavioral factors, social factors, and economic factors. So what a systems science approach does is really try to map out and model what those pathways are, so that we really understand, what combinations of nutrients and what their mechanisms are and how that ultimately will affect chronic health disease states. So system science are a suite of different types of methods that allow you to do that better and more transparently. And these are methods that have transformed other types of fields, such as meteorology, air traffic control, and transportation. So what we're recommending here is that a lot of these techniques like computer modeling and simulation can be adapted and changed to then help us better understand these nutritional pathways.
Right, and just to add, I think it's important to understand that in thinking about a systems approach, the committee is hoping that it also gives a better understanding of how diet and nutrition can fit into an overall system. So we understand more realistically what can diet do to help promote health and reduce risk of chronic disease.
I think, this is Rob, I think what it does, just to expand on that or say it in a slightly different way, is it brings some reality into the whole thing of what can be expected from diet. Diet is one of many factors that affect health, but we have to see how, understand how various factors interact with one another. It gives us a more realistic view of what can be expected by dietary guidelines.
Yeah. And so we still see the dietary guidelines focused on food and nutrition, but understanding the context better.
Thanks for that. Next question is, since the dietary guidelines point back to the dietary reference intake, or DRI, recommendations, what is the committee's thought on reviewing or revisiting the DRI's recommendations and how they align with overall dietary recommendations?
So certainly the DRIs are an important input into the dietary guideline process because the dietary guidelines focus on nutrient inadequacy, reducing risk of chronic disease. We would point out that obviously having current information on the DRIs is always going to be valuable, but the dietary guideline process is not a DRI process. It uses that as input. We would note that there is another recent report from the National Academies on how to establish DRIs for chronic disease risk. And certainly the principles and the information outlined in that report could be relevant and could have an impact on future dietary guidelines as another source of input into how do you promote health, reduce risk of chronic disease.
And this is Bruce Lee speaking again. Also wanted to add this is another place where bringing more of a systems approach can be helpful, because when you map out how everything's connected, this will also show the connections between other types of guidelines and processes such as the DRIs and how they connect to the DGA process.
Thanks, Bruce. Next question is, how do you expect the makeup of the DGPCG and the DGSAC groups to differ?
Well, I'll call it the continuity group so that we don't have to go through all the initials each time. Planning and continuity group. They would be made up of both federal and non-federal people, experts. They would be, if you want, I don't know how much detail to get in here because it's just a recommendation we had or thoughts that our committee had, that you obviously don't want that group to resign all at once, but half of the people would be go off the committee halfway through the DGA cycle, and half would remain, so that at any one time you have sort of institutional memory. They, of course, would undergo bias and conflict of interest assessment, just like any other group or committee working on the DGAs. The DGSAC is made up of outside non-federal employees, experts, and they also undergo obviously the bias and conflict of interest vetting and assessment that any other group does. But that's basically, maybe that's not quite what was meant by the questionnaire, but that's the makeup anyway. The functions are different, of course, so I've talked about that, what the functions of the two groups are. The DGSAC only works for 2 years during a cycle, whereas the planning and continuity group works through the whole 5-year cycle. Barbara?
Right, and so just to add what Dr. Russell has said, if you think of that planning and continuity group, they really focus on the topics that are needed for review, and so whether coming from a federal agency perspective, where is there a need for either a new area or a review of an existing topic, that's the kind of expertise that we want. And plus we see that group having a role in strategic planning across cycles of the dietary guidelines. So certain expertise and experience relevant to those two functions. With the Science Advisory Committee, in our proposed model, we see that really as a group that is going to have expertise on how to integrate the science and the data that are available to draw conclusions that are relevant to making recommendations in the DGA. So there could be content expertise there, but also we need individuals who have that expertise in that kind of integration, looking at an integrated view of different types of data and scientific evidence. There might be some expertise overlap, but I think those functions will dictate the kind of person that can best serve on each committee.
I'd also say that the DG SAC will be able to feed back to the planning continuity group questions which they did not address but they feel should be addressed in the next cycle. So there would be feedback between these groups.
And how does the DGPCG relate to FACA?
Advisory committees have a 2-year work plan, then they stop. But what we are able to do, what it has been done for other committees, federal committees and so forth, is that the advisory groups can be renewed on an ongoing basis. So that's how we see the continuity group acting over a whole 5-year period. In the case of the DGSAC, that is a 2-year, that would expire after 2 years.
Okay, next question. Can you clarify how the prevention of chronic disease will be included in the considerations for developing dietary recommendations?
Right. So that prevention, reducing the risk of chronic disease is certainly an important aspect of the dietary guidelines for Americans. And one aspect that our committee focused on was the recognition that the guidelines should be applying to the general public, not just the healthy public. So that could include individuals who are at risk for chronic disease, as well as it could include some individuals who are currently living with chronic disease. And to manage that, we had noted in looking at the various dietary recommendations, we understand that there are many recommendations from professional societies that exist related to diet and chronic disease. The DGA process is not really a place where those can be sorted out, but we have seen situations where there is scientific evidence to show how a particular dietary pattern may support the dietary guidelines. A good example is DASH, the Dietary Approaches to Stop Hypertension, where we have scientific evidence that that dietary approach can help reduce hypertension in the population. When that dietary pattern is looked at in the context of recommendations in the dietary guidelines, it's very consistent with the recommendations in the dietary guidelines. So we're encouraging that kind of approach to look at where dietary patterns that help prevent or reduce risk of chronic disease are in fact consistent with the recommendations in the dietary guidelines and how that can be used to help health professionals provide that type of advice to their patients.
And this is Bruce. This is another illustration of the importance of a systems approach, really drawing those pathways. You know, how is dietary intake, nutrition intake, nutrient intake ultimately then linked to the risk of developing different types of chronic diseases, whether it's obesity, diabetes, cancer, or a number of other different types of diseases that might be related to dietary intake.
Thank you, Bruce. Next question, can you tell us a little bit more about your recommendations for vetting and managing bias and conflict of interest across the multiple groups being proposed?
Well, if you go to Report 1, the recommendations that we developed in Report 1 about how to manage bias and conflict of interest, we believe would apply to each of the groups that we've proposed that could function in the dietary guideline process. So in that report, I went through the 4 steps in terms of disclosure, management, external review, and then documentation, that those 4 steps would be relevant to how members of each of these committees would be selected. And I think we know that for federal advisory committees, it's also important to have balance in the committee, and that's a required part of proposing those committees. So again, balance is something that we should be looking at across these different committees as well.
Next question, did the committee consider what recommendations could be implemented in the current cycle, so for the 2020 guidelines versus waiting for the 2025 cycle?
I think this is Rob. It's really up to the departments in charge of the DGA, the USDA and HHS to determine what they might want to try to institute earlier rather than later. Certainly the values that are in the slide set and in the report that Dr. Schneeman has talked about can be instituted right away. There are, of course, possibilities that other parts, other sections of what our recommendations are could be. It's unlikely that all of them could be right away because the process has already begun last 2 years. But I think that again, it's really up to the departments, agriculture and HHS, to make those determinations.
Right, and certainly we would hope that in the recommendations there are certain elements that they can begin with and begin to work into the process. As Dr. Russell noted, because essentially we're already in the 2nd year, there's some things that might be harder to do this first cycle, but particularly where we've articulated values, I think that philosophy can be useful in guiding what could be implemented in this next cycle of the dietary guidelines.
Thank you. We've been getting a lot of questions about costs. So what about the costs of all your suggested changes?
We looked into that and did some evaluations of that, but nothing extensive or formal. It's our committee's feeling that there will be some upfront cost increase in establishing a new group, that's the continuity and planning group. But ultimately the costs will reduce and it will probably be a cost-neutral process. Why will the cost be reduced? Primarily because it will be more efficient and effective process, and also that the number of questions that the DGSAC will have to be evaluating will be streamlined down, will already have been done for them, that streamlining, and it will be simplified, a simplified process for them. Again, we didn't do an in-depth cost analysis, but that is the consensus of our committee.
I would only add to what Dr. Russell has said, is certainly one can hope that if the dietary guidelines become a more trustworthy process that are used more widely and more relevant to the population and to healthcare providers, that it can also help reduce costs in terms of overall healthcare costs. So I think there are many ways that becoming more efficient, more focused, and more flexible and adaptive to look at where high priority issues are, I think there can be an overall benefit in that process.
And this is Bruce. I'd like to add a couple quick things. So one is, integrating systems approaches and building maps and models, that will require some upfront investment to get the ball started, to actually start building the models and the maps. But this will be an ongoing further developing the maps and models, almost like hanging more branches on the tree. So once the base models are established, you don't have to go and reinvent the wheel every cycle. So ultimately, that actually will be cost savings because this is a way of active continuous learning. So you're growing the understanding of how everything is connected, and you're simply adding to the tree as the process moves along. So ultimately, that's going to be cost savings, a lot more efficient to do.
Thank you, Bruce. And now we're coming up at the noon mark. So once you exit this webinar, you will be redirected to our report page at www.nationalacademies.org/DGA review. The slides from today's webinar will be posted on that page later today, and a recording of this webinar will also be posted on that page next week. And with that, I'd like to thank all of our speakers and thank you all again for participating. Have a good day.